Good afternoon, Tuesday, September 30, 2025. I'm Dr. Duke Majan, CEO and founder. Our patient travels here from Colorado. She's here with her husband. She's had back pain now for 6 years. We discovered 3 discs causing her back pain and 1 torn piriformis muscle. The discs, we're going to fix 2 of them on the left side, 1 on the right. We're going to do the right piriformis release afterwards. If you have questions, type them up. I'll answer them during surgery. We're going to do a little bit of local injection here just to numb up the skin. And I think we did that side already. We're going to get started. Our first step is to place needles into the disc so that we can repair those discs. And the way we get the needles in, we go through the foramen, which is a natural opening in the spine. We're going to go in at left L3-4, right? Yep. And left L4-5 to fix these discs. Every patient is a little bit different in terms of their anatomy. Some patients have a deeper spine. Some have a more shallow spine. This patient's spine is, I would say, average. Shot. I'm touching the herniation, AP. You can see on that lateral view, the tip of the needle is right at the back of the disc in the foramen. We're off on orbit by 1/2 degree. That's perfect. You can see on the AP view, the needle is coming in the foramen on the left side. Very nice. Jordan has done a phenomenal job with the imaging. I think we're off still 1/2 degree on orbit. Okay, I'm going to make my incision and basically we'll place the second needle here on the left side. This one goes in at L4-5. So I've already got one at L3-4. This next needle is L4-5 shot. And then we're going to put one more needle at L5S1. Shot. Perfect. I would love to if I can. Any questions, Henry?
At this moment, no current questions.
What a difference, huh, Margie? This compared to open back surgery with fusion. What an amazing difference that is. We have virtually no bleeding with this surgery. We literally lose a few drops of blood. With open back surgery like fusion, you're going to lose 1 liter of blood sometimes. It's much different, much worse. All right, any questions from the audience?
At this moment, no current questions.
John? Great, thanks, Henry. Let's show the audience then the 30 different things that cause back pain, because there are 30 causes. Shot? We're almost done here. I'm almost ready for discogram. I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L12, L23, L34, L45, and L5S1. The most common facet joints to cause chronic back pain are L45, followed by L5S1, followed by L34, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Majan. Thanks for joining us. Welcome back. Welcome back to Duke Spine Institute, the only place in the world you will find live spine surgery streamed live out of the operating room. Why? Because we are fearless. We want you, the audience, to see everything happening. We believe so much in our technology, our surgeries, how good they are, how well they work, how safe they are, how minimal bleeding it is. Just the most amazing surgery in the world to cure back and neck pain. We believe in our technology so much, we're going to show it to you live. We even take questions. All right, we just tested 3 discs on this patient from Colorado. Now, she had 10 out of 10 pain at L3-4, concordant. 10 out of 10 pain at L4-5, concordant. 15 out of 10 pain, L5S1, concordant. What does all that mean? It means when I asked her, where's your back pain? She said, deep in here, and she showed me this area. That was L3-4, L4-5, L5S1. We just tested those 3 damaged, bulging discs. All 3 were causing pain. Horrible pain, especially L5S1. Now we're going to go fix it with laser. Any questions?
At this moment, no current questions.
Let's show the audience how disc injuries can be so painful and what we do to fix them. Here at Duke Spine, revolutionary procedure you won't find anywhere else in the world. You got to come here to get it done. You want the Eiffel Tower, you go to France. You want to cure your back pain, you come to Duke Spine.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
I was just telling my staff that the laser itself, as it works over the herniation and removes it, as you guys are seeing on the video, it makes a sound. It sounds like a kitty cat that's purring in your lap. You know, when you get the cat going, you start stroking its back and it just relaxes there and it starts purring. I mean, if you've never had a cat purr, then you've got to do it just for the experience. Not only do you hear the cat purr, but you feel it. It's a hearing and a feeling experience. So the laser, not only does it visually destroy covalent bonds between proteins, disrupting the herniation into little pieces, breaking it up so it can be floated out, like you guys see a big piece right there. But the laser also creates a cavitation wave in the water or liquid that's surrounding the herniation down here, down at the bottom of the tube. And that cavitation wave creates a rumble, like a low vibration. It's like exactly what a cat feels like when you're petting it on your lap and it starts to purr. You hear it and you feel it. You hear the purring and you feel the deep body vibrating on your leg. It's pretty cool. Anyway, any questions from our audience?
At this moment, no current questions.
All right, so we'll just talk. That laser fiber is 1 millimeter wide, 1 mm. That's tiny. The reason you see it so big is we have the endoscope or scope, which is illuminating, lighting up. And just so you understand what it's like, if we were to take away the light, this is what it's going to look like if we took the light away. See? And here's when we bring back a little bit, like a night light, and then there's full production light. So the scope brings light from a box here in the operating room, a very expensive light box. And it transmits the light all the way down to the tip of the scope. Just like a car, a headlight of a car shines the light out in front of the car so you can see. And if you have a good light, you can see well. If you have a bad light, you don't see so well. So we have a very good light, fiber optic light, that's shining at the end of the scope. And then you have a lens system that takes the image that's seen at the end of the scope, which is the same image you guys are watching right now. and it transmits that image to a camera, a very high definition camera, which we have attached that camera to a monitor so that we can actually see what the camera sees. And you guys are seeing what the camera sees. So the laser is transmitting laser energy out of the tip of that glass fiber. It's a fiber optic glass fiber that transmits laser energy from a machine near the patient's feet that's managed by our technician, the lovely Nikki. And she regulates the energy levels coming out of that machine. She troubleshoots problems with the machine, and she helps set up the operating room. And when I need somebody to yell at because I'm in a bad mood, she is that person, right, Nikki? She's my punching bag. She's my punching bag. All right, any questions? Nada? Not a whole lotta? Yes, no, maybe so? Henry, I can't hear you.
No current questions. Sorry, Margie and I were just having a quick
All right,
discussion.
I want to tell you guys, we have a lot of nurses out there that love watching us. And I want to tell you, this patient is a nurse. She's a nurse. We get a lot of nurses here at Duke Spine. Why? Because nurses are smart. They don't want invasive spine surgery. They've seen the patients that have fusions. They've seen the patients that had laminectomy. They have seen the patients that had spinal cord stimulators put in. They've seen the patients with discectomies and every other spine procedure out there. And guess what these nurses do? They watch those patients and see how they do. And the reason these nurses travel from Colorado or California or Hawaii or everywhere that they come from to Duke Spine is because those nurses are smart. They've done their research and they know this is the best surgery in the world. That's why they travel here. They travel here for the best surgery for their back and their neck. They don't want the invasive surgeries because they know the results are very bad. I want to congratulate Henry for completing another milestone video, which we're going to release probably at the end of the week or next week. And this video is comparing the cervical Duke laser disc repair to other treatments. And to remind you of the magnificence of his work, I'm going to have Henry share with you right now the video he created about a year ago, Duke laser disc repair versus all the other treatments available. Hi, I'm Dr. Duke Majan. We've just completed our free MRI review at Duke Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that is causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Duke Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Duke Laser Disc Repair. We've been performing the Duke Laser Disc Repair since 2006 here at the Duke Spine Institute. To date, we've had 0 complications. The Duke Laser Disc Repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Duke Laser Disc Repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Duke Laser Disc Repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Duke Laser Disc Repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Duke Laser Disc Repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Duke Laser Disc Repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Duke Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. I don't know. No, he's not the inventor. Welcome back. You've seen Henry's magnificent creation, the Duke Laser Disc Repair versus all the other treatments available today that are commonly recommended by doctors for patients. Look at that inflammatory tissue, Henry. We talk about this all the time. Earlier today, we had a beautiful inflammatory tissue on the annulus, and there it is again. right there. This is a different patient. This is a nurse from Colorado. And look at that. There's your inflammatory tissue right there. So we're going to use the laser to clean that stuff up. There's going to be more, by the way, but that's the first that we're seeing while we're here in this L34 disc. L34 or L45? Yeah, we've already done L45. This is L34. So we're doing L34, L45 on the left. We've already tested these discs, and indeed they were painful for her. So when you see a herniated disc, most herniated discs are not painful. They don't cause symptoms. They're totally silent. Asymptomatic, we call it, silent. They don't produce any symptoms at all. As a matter of fact, virtually every human being alive over the age of 45 has a herniated disc in their back or neck, but they have no symptoms. Only about 15% of people have symptoms. They have pain in their back. They have leg symptoms like weakness, numbness, tingling, or they have fatigue in their legs as they walk. Point is, most disc problems are silent, but 15% of people they're not. We cannot predict who the disc injury will be silent and who it will be symptomatic, but we can fix the ones that are symptomatic. And for this patient, when I talked to her on Zoom, she was in Colorado where she lives. She was telling me about 6 years of back pain, and she wanted to get rid of it, but the doctors there could not fix her, and they only had invasive surgery to offer. She didn't want invasive surgery because she knows invasive surgery doesn't work. She's a nurse. She's seen the patients who got invasive surgery. Long story short, she found Duke Spine, found out about the Duke laser disc repair, the best treatment in the world for painful discs, which is what she had. So I just verified at the beginning of surgery that the L34, L45, and L5S1 were causing her everyday pain because we did what's called an evocative discogram. Now, an evocative discogram is where the doctor puts a needle in the disc, and without the patient knowing when, we inject a little bit of saline, like just to pressurize the disc. And if the disc is a painful disc, the patient will suddenly say, "Ow!" That's what she did. She ended up saying "ow" to all 3 discs. Okay, and it turns out that pain was a 10 out of 10 at L34, L45, and it was a 15 out of 10 at L5S1. So, why is that good? It's good because now we know for sure these discs are the cause of her back pain. And we know for sure that pain will be gone tomorrow. When she comes back to the office, it will be gone. The Duke laser disc repair is the only surefire cure to back pain coming from a disc injury. Any questions?
Yes, we have a question coming from Jose on YouTube
Hello, Jose. Welcome.
asking, "Hi, do you work with the VA?" Thank you.
Yeah, we take patients with any insurance. The problem is not us. The problem is the insurance. The insurance may not pay for all of our treatments. The VA will cover certain treatments. It doesn't cover all treatments. Okay, but that's true for any insurance. Many treatments these days are denied by insurance. Just to give you an idea of how often doctor-recommended treatments are denied, the Wall Street Journal published this year that there are 750 million medical procedures every year denied by the insurance companies. So, do the insurance companies approve everything doctors recommend? No, they don't. As a matter of fact, they don't. And it's unfortunate they don't, but they don't. So we do take VA, but VA doesn't pay for everything we do. It should, but it doesn't. Look, the VA, unfortunately, I worked in the VA hospital 7 years. in the VA hospital in Gainesville, Florida. And I can tell you all about the VA. The VA system has no interest in helping the vets. All the VA wants to do is save money and stay out of trouble. And typically the two are not conducive with each other. So the vets would come in, they would want to be seen by our doctors in neurosurgery, and the VA would make them wait 6 months to a year to be seen for just a regular problem. So our doctors got tired of making the vets wait. The doctors said, we want to see more patients. We're willing to come earlier, stay later, and work harder to take care of the vets and get rid of the backlog. What do you think the VA said to that? They said, no, we're not letting you treat more patients. Why not? Well, we're not going to give you a reason why, but we know the reason why. It's because they don't want to spend the money. Okay? More patients equal more treatments equal more cost. That's pure and simple. And it's true for every single service line at the VA. Whether it's orthopedic surgery, there's a 2-year wait to get surgery. Whether it's neurosurgery, the VA hospital takes measures on a daily basis to prevent vets from getting medical care. They do it all the time. They do it, the entire system is designed that way. We actually tried to do surgery on vets to get rid of brain tumors or treat their spinal stenosis, and the VA would say, if you can't start the surgery by 2 o'clock, if you can't finish the surgery by 2 o'clock in the afternoon, you cannot post it. You cannot put it on the board. You cannot add it to the schedule. Can you imagine, Dr. Berndes, if we didn't finish the surgery by 2 o'clock in the afternoon, we can't do the surgery. We wouldn't get anything done. So that's one way the VA saves money, is by basically blocking the surgeons from doing more surgeries by limiting the times that they can operate. There's no other hospital in the world that does that. The VA system is the only one that blocks surgeons from doing surgery because they're trying to save money and not have to pay for those vet surgery. That is the ugly truth. And I will tell you the truth because I believe patients should know the truth about what's happening in our healthcare system. I don't believe in sugarcoating. I don't believe in hiding the truth. I don't believe in lying on behalf of the system to patients. You guys need to know the truth. The truth is the system has failed you. And your politicians are dirty politicians. They're taking the money from our government and spending it overseas on stupid projects like Sesame Street in Saudi Arabia or wherever it was they're doing Sesame Street, instead of paying for vets. The other way they're wasting your money is electronic medical records system. Okay, it's the biggest scam there is. The VA hospital has paid over $10 billion in electronic medical records system fees, and the system isn't even fully functional. Okay, that's $10 billion that could have gone towards back surgery, neck surgery, hip surgery, knee surgery, cancer surgery, to vets. Instead, it was given to multi-billionaire companies like Epic or Cerner that installed these electronic medical record system, which is basically just a computer program that they developed and they sell for an obscene amount of money, hundreds of millions of dollars. The VA had to pay billions of dollars for it. It's disgusting to see the money wasted on these electronic medical record systems that have never been proven to help patients in any way. It's a scam. And the politicians are in on it. The government is in on it. And the veterans are the ones suffering. So, I'm sorry the VA has failed us. But it's the God's honest truth. Almost done with this disc. Any other questions?
No current questions, so we do have a comment from Jose once more on YouTube saying, I have VA healthcare. That's so unfortunate. I go to you in a heartbeat. I like how you speak the truth.
Thank you. I'm sorry, Jose. I wish to God I could fix you. I really do. I just don't know that the VA is going to cover it. This surgery, if that's what you need. Now, the VA will cover shots. They'll cover an office visit. They'll cover pills, things that won't cure you. That's because they don't want you being cured. They want you basically giving up so that you don't cost them any more money. That's the truth. I don't know how else to put it. And by the way, the politicians know about these problems. They choose to ignore them. You know, the politicians in Washington, D.C. that run the VA, they get the best health care in the world. Whatever their doctors recommend, there is no denial for them. There's no such thing as the word denial. If you look at the denial rates in Washington, D.C. compared to the rest of the country, they're going to be the lowest in Washington, D.C. They're high for the rest of the world, but politicians always get whatever they want health-wise. The insurance companies know who they are, and they don't deny those treatments. How does that make you feel to be discriminated against in such a way that we commoners get shitty health care because our insurance companies don't want to pay for it? It makes me angry. I can see why people are upset and why they're doing something about it. But more needs to be done. The problem is not going to fix itself. And the corrupt politicians are perfectly happy with you guys suffering as long as you're willing to suffer. But if you're going to make an issue out of it, they're going to have to listen. They're going to have to respond. So my advice, make an issue out of it. All right, we are done with this disc. Beautiful tear, big tear, should heal itself in about 9 months. So she's going to have to be careful because she is a nurse. She's going to have to be careful with what she does over the next year. She can't lift patients. She's going to have to just take it easy and let this disc heal. If she does, she'll be rewarded with a pain-free life. The only way the pain is going to come back is if she re-injures her disc, which she's not going to do. All right, any questions for me?
At this moment, no current questions.
We've done 2 discs. We're going to go to the third on the right side, and then we're going to fix her piriformis muscle tear. Guys, see the incision? It's tiny.
Yes,
Almost
we do.
no bleeding, just a few drops of blood. We've lost probably 5 cc's. You can see the incision is 7 millimeters. It's tiny. Blood pressure is good. Let's get it down a little. I like the blood pressure on the low side of normal during surgery. It keeps people from bleeding. We don't like bleeding. All right, any other questions?
No current questions, so we do have a comment from Jose once more on YouTube saying, I'd get into trouble if I totally spoke my mind about these politicians. They need a taste of their own medicine.
Oh, hell yeah, they do. And by the way, it's that fear right there that you're afraid. That's what they know will keep you quiet. People, they're afraid of people like you speaking your mind. But if you all get together and speak your mind, and I can tell you right now, I talk to a lot of vets, especially when I worked at the VA, okay? And they're all feeling the same way. And they're all experiencing the same thing. It's not unique to you. It's not unique to today. It's been going on for 30, 40 years. The vets were promised that if they go out and fight for our country, fight for our values and our beliefs and our people, that they would be rewarded with certain things. And one of those things is great health care. But they lied to you, and they've taken that away from you. They promised you great health care, and then they give you shit. Now, the doctors at the VA, for the most part, many of them are good doctors. What they do is they limit your access to the treatment by those doctors. In other words, they don't give you the access you need to get care. Like You know, private medicine, you can just go to the hospital or go to the doctor's office and be seen within a few days or a few weeks. Okay? But in the VA, I mean, waiting 2 years to be seen, I mean, there's nowhere else in the world you have to wait 2 years to be seen. So there's something very, very wrong with our system, especially when it comes to vets. Speak out. I'm speaking out. You should have the courage to speak out too. Nothing will change until all of you begin to share one voice. That's the only way it's ever going to get better for you. You know, dealing with patients with back pain, one of the biggest issues I deal with is their family members and friends just think they're complaining about pain. They don't have back pain, those people, and they don't understand how it affects the person's life. They minimize the symptoms, they minimize the complaining. They don't take it seriously. But the person who's suffering every day with back pain, they are truly living in hell. So you're the same way, you vets. You guys are getting horrible veteran VA care, elective care. Sure, the emergency room's always open, but then they just send you to the clinics. They don't really treat you properly. But you guys are just quiet about it, and you all think, well, I don't want to complain. I don't want to complain, you know? I shouldn't be complaining. No, you have to complain. Because what's happening, it's an injustice to our veterans. It's an injustice. And the only way the public's going to know about it is if you guys raise a stink. That's what I'm doing. I'm raising a stink right now. I'm talking about it. I'm not afraid of the truth. Okay, there it is, folks, right there. You see that red thing at 12 o'clock?
Yes, we do.
That is the cause of her disc pain, her back pain. She had 3 of those. We already cleaned out the other 2 discs. We're about to clean this one. That is inflammatory tissue, aka granulation tissue. That's where all the pain fibers are, and we're going to go zap those away, and we're going to cure her back pain right now. That's how easy it is. But the Duke laser disc repair, the procedure I discovered, is the only treatment in the world that does this. Everyone else does fusions and laminectomies that don't work because they're not addressing that little thing right there. It doesn't matter that her disc is degenerated. That's a degenerated disc. That's what it looks like. The only thing hurting right now, this woman, is this area right here where the inflammatory tissue is. See, there's some more right there. You guys see it? The pink stuff right there? I'm going to zap that away and her pain will literally be gone. That is the size of 1 millimeter. I'm going to show it to you in a minute. Just to give you an idea of how big it is, okay? This laser fiber is 1 millimeter across from side to side. Look at how small that is, that inflammatory tissue. But it's so painful. So very painful. And I'm the one who discovered this and how to cure it. And I've been telling doctors about it for 20 years. They just don't want to listen. They don't want to adopt it. They want to keep doing what they're doing. And it got me thinking maybe they don't want to fix people's back pain. Maybe just like the VA doesn't want to fix the vets because it costs money. Well, these doctors don't want to fix your back pain because they're going to lose money. Once they cure you, you're gone. You're no longer coming to their office for pain pills. You're no longer going in for shots. You're no longer getting stimulators put in and fusions done or laminectomies done. Basically, it's big business. And they're using your bodies to make a living. Shouldn't be that way. Okay, there's nothing wrong with doctors making a living, okay? I'm not against that. I'm for that. But I am against it when they hurt people and they keep them suffering so that they can make money. And that's what's happening. You guys got to know the truth. I used to be a fusion surgeon myself. For many years, I've done 1,000 fusions on people's backs. I stopped doing them because I realized it's totally unnecessary. Yeah, they pay me a lot of money I made the most money in my career doing fusions. But now I do laser because it's better for the patient. Far safer, immediate recovery, no narcotics after surgery. Everybody's happy with the results. All right, we're just about done. I got about 1 minute left, Berndes. And then I'm going to go on to the piriformis. Any other questions? You better ask them now. Otherwise, we're gone. We'll be back for one more stream on a piriformis release.
At this moment, no current questions.
All right. In that case, why don't you, what have you shown our audience? How discs cause back pain, how we fix it?
We have not shown them that.
Let's do that.
Of course.
And then we'll wrap it up.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, we're done here. I understand the classic car nut has a question for us.
Yes, classic car nut on YouTube asking, can new scar tissue form after DLDR? If so, could that new scar tissue lead to nerve compression? I enjoyed the spine scan movie, by the way. Thank you.
Oh, good. So new scar tissue does not form after the DLDR, and it does not lead to nerve compression. If somebody has the DLDR and they've got nerve compression, it probably is not at the levels that we treated, or if it is, it means that they have a re-herniation. They've done something to re-injure the disc. All right. Great question. We're going to end the stream, and we'll be back for a